My name is Tiziano Scarabelli, and I am the Director of Translational Research based at St. John Hospital and Medical Center, which is a big teaching hospital affiliated with Wayne State University. Also, I carry out my clinical work at Mount Sinai Hospital in New York. The topic for which I was invited, it is something which I consider to be quite intriguing and promising for the future. We all know that diabetes is a disease whose presence is actually leading to increased morbidity and mortality in patients undergoing on-pump cardiac surgery. Situation where the heart is mechanically stopped by infusion of cardioplegia to allow the manipulation of the surgeon, after which the heart is actually reperfused and restarts beating. So this situation creates what we call iatrogenic ischemia reperfusion injury, namely a small damage which is called by a physician, and that's why it's called iatrogenic. So what we have seen is that there are possible explanations for the molecular mechanism by means of which diabetes results in increased morbidity and mortality. It is something which is related to the fact that diabetic hearts have a lower expression of a small peptide called urocortin, which has a very important cardioprotective action in normal conditions. So as compared to people without diabetes, the hearts of diabetic patients have a lower expression level of this small peptide, and at the end of cardioplegia, in diabetic hearts, the overexpression of urocortin does not take place. And this we have seen that by means of failure of overexpression of PKC epsilon and overexpression of PKC delta, which are PKC protein different isoforms resulting respectively in protection and cardiotoxicity, we have an enhanced occurrence of apoptotic cell death, which is associated with cardiac dysfunction. So the message would be the following. In conclusion, we do believe that urocortin supplemented to cardioplegic solution have the potential to reduce to a minimum the myocardial dysfunction which is seen in patients with diabetes undergoing on-pump cardiac surgery, and hopefully a clinical trial which is about to be started in 2 different countries will be able to prove this translational observation.